have a soldier that comes back,
Yes.
and he doesn't have what you would classify as post-traumatic
Stress.
stress, but he has issues
Mm-hmm.
that are related to killing and
Mhm.
war and the effects
Mhm.
of
Mhm.
war, where he's been changed and he's having a
Mhm.
hard time adapting.
Mhm.
Explain how thought field therapy can assist.
Well, I think it's important to approach this with kind of a comprehensive understanding of what it's about to work with people who have undergone traumatic stress. Because traumatic stress is going to affect us in a lot of different ways. And not only do we come up with post-traumatic stress disorder, there's acute stress disorder, there's an adjustment reaction disorder. There are people whose anxiety disorders, generalized anxiety disorders, may be made worse by the events of war. So we have to think about this in a more comprehensive way than just, it's one thing. War is going to affect a person depending on who they are going into it, what their experiences are while they're there, and the kinds of resources and the kinds of things that they come out to. And I think it's important to remember that when we're looking at traumatic stress recovery, I think of it in terms of 3 phases. And I think it's important to be aware of that the first phase is you've got to manage the symptoms. You've got to make sure that people are safe. When you're exposed to an event that's life and death, when you believe that you are about to die, or that someone you love is about to die, or you're about to find yourself in a situation where you need Herculean strength in order just to survive, what happens is the body triggers a sympathetic response, which simply means that it's the same thing that the human being's been doing since the time of the saber-toothed tiger. So now you have a fight or flight response. Adrenaline pumps, you get all of these biochemical changes in the body, in the mind. Neurotransmitters are flowing all over the place in a specific way to make sure that we have the strength that we need to fight off whatever the event is or to run away from it. Now, that sympathetic response is a good thing. The problem is that when we're constantly exposed to it, it keeps firing, and it becomes one that our system then gets overloaded with it. In a normal response, we would have the fight with the saber-toothed tiger, we'd run away from the saber-toothed tiger, and then we would have what's called the parasympathetic response, which is that it's a relaxation response, that the chemistry of the body and the mind would change such that we would find ourselves calming down. Instead of pumping blood to the muscles, we would no longer see that as the highest priority. We would be able to pump blood to the stomach to process food and energy. And so that interplay between the sympathetic and the parasympathetic is what's incredibly important in terms of being healthy. The problem is that if we find ourselves in a situation where we're constantly in danger, that we're firing that sympathetic response consistently, the body loses its ability in some ways to do the parasympathetic, to do the calm down part of it, because it's not safe to. So what happens is that when we're constantly in this state of hyperarousal, that our body goes through some changes. And sometimes with a little bit of rest, we're able to kind of come back to a normal state. Sometimes we're not. Sometimes we stay in that state of hypervigilance, which is one of the symptoms of post-traumatic stress disorder. We talk about an exaggerated startle response. Well, all of us will jump if we suddenly get a loud noise that scares us. But the difference is that if you have post-traumatic stress disorder, or if you're in that state of hyperarousal, what's going to happen is you're going to be aroused again, you're going to be startled, and you're going to stay there for a long time. It's going to be very hard to calm down. And so what happens is the body begins to try to adapt to these things. And the danger is that in people who have severe PTSD, instead of seeing a startle response, you get no response at all. So there was some interesting research that was done trying to use startle response as a way to determine whether or not somebody has PTSD. The problem is that there's this process that happens if you have it long enough and bad enough that you begin to adapt to it and not be responsive to things, which can be dangerous too. So what you've got going on is all these kind of sympathetic responses, and these turn into symptoms. And those symptoms then are of hyperarousal. And then we find ourselves getting intrusive images, finding ourselves thinking of things that we don't want to be thinking about. We can't control when the memory comes up. Some people talk about it as flashbacks. Some people have nightmares. But it's all that activity going on all the time, and we don't have control over it. Then we begin to avoid things that remind us of those things or that might trigger us to that. When all of that kind of comes to when you meet a certain level of symptomology, then you have post-traumatic stress disorder. You can have acute stress disorder, but you can also have a traumatic stress response, which is normal, but will extinguish over time. So why is it some people get PTSD and others don't? We don't really know. There isn't really good understanding of that from a biochemical or even a behavioral aspect. So, but we do know that many people do. And it seems to be that the worse the stress, the less prepared we are for the stress, the longer going the stress, those things can make it worse. But the thing I think is important to remember is that there is no way to really gauge how somebody experiences something from the outside. What a soldier like Ross might think is common everyday stuff would terrorize me. And my experience in response to that would be very different than his. And there's no way to predict how your body will respond to things until you find yourself in those situations and until you begin to experience it. And I think one of the things that is hard for me working in this field is that people who've never experienced it tend to think it's not real because that's not how they feel it, that's not how they see it, that's not their experience of it. And that's true. But you have to understand that everybody's response to these things is different. And we have to have a little compassion for one another because what freaks you out may not freak me out at all.